If you're one of the millions of breast cancer survivors out there, congratulations. And yes, you obviously feel so blessed to be alive. But at the same time, you probably also know how difficult it is to feel pretty again. A cancer diagnosis is emotional and traumatic, but for a woman, the loss of a breast can also be a distressing and very personal loss. Breast reconstruction has certainly come a long way over the years, thanks to renowned plastic and reconstruction surgeons like my guest, Dr. Christina O'Shaughnessy. She's here to talk about some of the surgical challenges and new options for breast reconstruction. Along with her, one of her special patients, Kimberly Colley. Good morning.
Good morning.
Thank you so much for being here.
Thank you.
Kimberly, let me start with you. Can you share your personal story, your diagnosis?
I can. In 2011, I went in for my regular mammogram, and ironically, I had almost canceled that appointment, and I was just going to put it off just for a little bit, and I talked myself into finally just going. It was no big deal, and that was the day that my cancer was found. A lot of things happened really quick after that, and you have to make a lot of really fast decisions. And I decided to have a bilateral mastectomy followed by reconstruction.
Were you scared?
I was absolutely terrified. It was the scariest thing I've ever gone through in my entire life.
Doctor, Kimberly's story is a story I've heard so much. From a doctor's perspective, what are some of the different reconstructive challenges with breast cancer patients?
Sure. So in discussing the type and timing of breast reconstruction, I have to take into consideration many factors. And the reconstructive plan is individualized for each patient. From a plastic surgeon's perspective, there are many reconstructive challenges, and they can be divided up into patient issues such as comorbidities, or into previous breast surgeries or previous breast treatments such as radiation, or issues related to the mastectomy itself. As far as one of the main reconstructive challenges, it has to do with patient issues that may cause adverse issues with wound healing at the time of mastectomy. Previous breast surgery can lead to scarring. Previous radiation therapy can cause extensive tissue damage. And then at the time of mastectomy, there can be obliteration of the breast borders that we need to recreate.
So what do you do when you're faced with all these challenges, doctor?
Well, the goal of breast reconstruction is to recreate the breast, and there are many options to do that. You can use implant-based reconstruction like Kimberly had, or you can use your own tissues in the form of tissue from either the belly, the back, or the abdomen. And it really depends on each patient's individual situation. If a patient has had extensive tissue damage from previous surgery or from radiation therapy, then it might be best for the patient to use their own tissues for reconstruction. But if a patient is going to undergo radiation therapy after a mastectomy, we may want to start with an expander. There have been several innovative technologies, including acellular dermal matrices or tissue grafts, that have expanded the options for breast reconstruction and has allowed us to reconstruct breast with advanced techniques over some of the techniques available today.
I'm really glad we're talking about this because I didn't realize all the factors involved. When we come back, we're going to talk more with the doctor and Kimberly, because coming up after the break, we're going to hear more about some of the groundbreaking techniques and technologies that are now available to surgeons like Dr. O'Shaughnessy and patients like Kimberly who are looking to feel whole again after breast cancer. Stay right there. Welcome back. We're in the middle of a very special episode of The Balancing Act dedicated to breast cancer. I'd like to welcome back Kimberly Colley and Dr. Christina O'Shaughnessy. Before the break, we were discussing Kimberly's breast cancer journey and some of the challenges that plastic surgeons like Dr. O'Shaughnessy face when trying to reconstruct a woman's breast after cancer. Thank you so much for joining me again. Kimberly, I'm going to start with you. Tell me what you opted for after your diagnosis and what you did.
I went with the bilateral mastectomy.
Okay.
I had a pretty significant amount of tissue loss in my left side. I had tissue reinforcement, and then I did the fat grafting. And I even got a little bit of liposuction.
Oh, well, hoo-hoo, why
Yes,
not, right?
Of course.
That's a bonus.
That's exactly what it was.
Doctor, talk to me about these techniques, if you will.
Sure. So the tissue graft that Kimberly is referring to is acellular dermal matrix, or regenerative tissue matrix called alloderm, and it's from LifeCell. and it is processed in such a way that the cells are removed. It's donated from humans, and there's a proprietary technique. After the cells are removed, you're left with this scaffold that the patient's own blood vessels and cells can then grow into.
Really?
So it becomes part of them. It's regenerative, and it acts like native tissue, so it minimizes the risk of rejection. So at the time of mastectomy, a tissue expander is placed, and then alloderm is sutured from the muscle down to the chest wall to help to recreate the breast borders and to also help to supplement or reinforce the weakened tissue that can be damaged at the time of mastectomy. I used to have to raise surrounding muscles, and that was very painful for patients. It was also very traumatic, and I no longer have to do that with the use of alloderm.
Now, what about fat grafting procedures?
So fat cells are taken from other areas of the body where there's excess, such as the abdomen or the thighs, and then it's transferred to the breast to fill in contour deformities or to restore shape or volume. And the fat is taken with traditional liposuction techniques and cannulas like Kimberly described, so patients will get an added benefit to it. So traditionally, fat grafting has been a little bit unpredictable, and that's because of variable resorption rates. And it's because there's no standardization of the processing step in fat grafting. So a new technology called the Revolve system allows us to effectively harvest and process large volumes of high quality fat for reinjection into the breast after mastectomy. Revolve controls many of the critical variables that are important in the processing step of fat grafting.
And are all these new technologies for all patients?
Well, breast reconstruction is individualized for each patient.
Sure.
So I do think it's important for each patient to talk to their surgeon about the risk and benefits of both alloderm and Revolve to be sure that they are right for that patient. Innovations and advances in breast reconstruction, such as Revolve and alloderm, have really changed breast reconstruction. It's opened up many options, and it's allowed us to optimize outcomes for patients with breast cancer who have to undergo bilateral mastectomy, like Kimberly.
And I do want to bring you in, Kimberly, in terms of your outcome. You look gorgeous. I know you're feeling
Thank
great.
you.
Tell me where you are today.
I'm doing fabulous. I'm in remission, and I'm just doing wonderful. I have had cancer, but cancer's never had me.
Thank you so much. God bless you.
Thank you so much.
Thank you so much, sweetheart. Doctor, thank you so much
Thank
for the
you.
information. You've taught me a lot today, and I'm very happy to have you here. Come back with anything new you might have to tell us, okay?
Thank you very much.
Again, good luck to you, Kimberly.
Thank you.
And make sure to head to thebalancingact.com for more information. That's thebalancingact.com. And don't forget to join us always on Facebook and Twitter.